Hello everyone, and welcome to the American Academy of Neurology's Virtual Resident Education Lecture Series. It's great to have so many of you joining us today. My name is Your Name, and I'll be your guide for this exciting dive into the world of sleep medicine. Whether you're a neurology resident, a medical student, or simply passionate about the brain, you're in the right place. Sleep is one of the most fundamental, yet fascinating aspects of our lives and our health. As neurologists, understanding its complexities is not just an advantage, it's essential for providing comprehensive patient care. Over the next few minutes, we're going to journey through the core principles of sleep medicine. We'll start by building a strong foundation, exploring the basics of sleep architecture. We'll demystify the stages of sleep from the light stages of N1 and N2, down into the deep, restorative N3 sleep, and of course, the ever-intriguing REM sleep, where most of our dreaming occurs. Understanding this cycle, known as the hypnogram, is the key to unlocking everything else we'll discuss. We'll look at what a normal night of sleep looks like and how these stages progress, setting the stage for when things go wrong. From there, we'll move into the clinical side of things, focusing on the most common sleep disorders you'll encounter in your practice. We'll begin with obstructive sleep apnea, or OSA. This is a condition you'll see time and time again, affecting millions of people. We'll discuss its pathophysiology, what's actually happening in the airway, and more importantly, its significant neurological consequences. We'll cover the classic signs to look for, like snoring and daytime sleepiness, and touch on the gold standard for diagnosis, the polysomnogram. Next, we'll shine a light on insomnia, a disorder that can be incredibly distressing for patients. We'll differentiate between sleep onset and sleep maintenance insomnia, and discuss how crucial it is to take a thorough history to uncover potential underlying causes. We'll explore the principles of cognitive behavioral therapy for insomnia, or CBTI, which is the first-line treatment, and discuss why it's often more effective in the long term than simply prescribing medication. This is a key area where neurologists can make a huge impact on a patient's quality of life. Then, we'll venture into the world of central disorders of hypersomnolence, with a focus on narcolepsy. This is a classic neurological condition characterized by excessive daytime sleepiness and unique features like cataplexy, sleep paralysis, and hypnagogic hallucinations. We'll talk about the underlying biology, particularly the loss of orexin-producing neurons, and how we diagnose it using tools like the Multiple Sleep Latency Test, or MSLT. Understanding narcolepsy is a perfect example of the deep connection between sleep and core neurological function. We will also cover the parasomnias, those unusual behaviors that occur during sleep. This is where things get really interesting. We'll talk about REM sleep behavior disorder, or RBD, where individuals act out their dreams. This is a critical one for neurologists to recognize, as it can be an early indicator of neurodegenerative diseases like Parkinson's disease or Lewy body dementia. We'll also touch on non-REM parasomnias, such as sleepwalking and sleep terrors, which are more common in children but can persist into adulthood. Of course, a big part of our job is using the right tools to get the right diagnosis. We'll take a closer look at the polysomnogram, the sleep study. We'll break down what we're actually measuring with all those wires, the EEG for brain waves, EOG for eye movements, and EMG for muscle tone. Understanding how to interpret the basics of a sleep study report is a vital skill. We'll also briefly discuss other diagnostic tools, like actigraphy, which uses a watch-like device to track sleep-wake patterns over weeks, giving us a real-world picture of a patient's sleep habits. Finally, we'll bring it all together by discussing how sleep intersects with other neurological conditions. How does poor sleep affect a patient with epilepsy? What is the relationship between sleep disruption and migraine or stroke recovery? We'll explore how treating an underlying sleep disorder can sometimes be the key to improving the primary neurological condition. For example, managing OSA can lead to better seizure control or improved cognitive function after a brain injury. This integrative approach is really the future of neurology. This field is constantly evolving, with new research and treatments emerging all the time. Our goal today is to give you a solid, practical framework that you can build upon throughout your residency and your career. Think of this as your launching pad into the fascinating and vital specialty of sleep medicine. So grab your coffee, or perhaps a decaf given the topic, and let's get started on our journey into the neurology of sleep. I hope you find this session valuable and that it sparks a deeper interest in how we can help our patients achieve better health through better sleep. Thank you so much for your attention and for being part of this AAN educational series. If you found this lecture helpful, please give it a thumbs up and don't forget to subscribe to the American Academy of Neurology's channel for more educational content designed specifically for you. We look forward to seeing you at our next lecture.